Coming up next on Arizona Horizon, ASU and the Piper Trust are teaming up on a new initiative to improve healthcare in Arizona. And we take a look at Arizona's water future and the challenges to meet the state's growing demand for water. That's next on Arizona Horizon.
Arizona Horizon is made possible by contributions from the Friends of Eight, members of your Arizona PBS station. Thank you.
Good evening and welcome to Arizona Horizon. I'm Ted Simons. A Superior Court judge orders Arizona to finish rolling out its voter-approved medical marijuana program. The state initially registered patients to possess and use medical marijuana, but under the direction of Governor Jan Brewer, the state refused to license marijuana dispensaries while it challenged parts of the law in court. Now, the order issued late Wednesday by a Maricopa County Superior Court judge requires the state to implement its medical marijuana program, and it overturned planned restrictions as to who can open a dispensary. The governor has the option to appeal the ruling. The Virginia Piper Charitable Trust today announced a major investment in Arizona State University. The trust will put $2 million a year for 5 years in a fund that ASU will use to improve the delivery of health care. Here to tell us more about the $10 million investment fund is ASU President Michael Crow and Piper Trust President and CEO Dr. Judy Moraz. Good to see you both here. Thanks for joining us.
Happy to be here.
Give me a better definition of what a strategic investment fund is.
Well, imagine a seed fund. Imagine venture capital. Imagine those critical early dollars that can attract many more dollars and that can have effects and consequences well beyond those initial seed funds. So what the trustees did was to say to President Crow, what do you need to really move forward and propel this vision you have for health outcomes at ASU? And what kind of funds do you need to move in a variety of areas, not just one, not just two, but across the board? So that's what the fund is there for, and we expect a return on the investment to be astonishing.
Talk about the expected return on this particular investment. What kind of return should we look for?
I think there's two things to focus on. First and most importantly is our focus of all of the university's assets that will use this internal investment fund to bring together to catalyze new know-how, new techniques, new tools that are focused on community health outcomes, not the university's outcome, the community's health outcomes. That is, we're driving towards that. And the seed fund, the catalyst fund, the venture fund, whatever you want to call it, will be used to grow what we hope will be a $100 million a year sustained knowledge production program, which has as its sole objective not the production of the knowledge itself, but knowledge that measurably affects both the positive health outcomes for Arizonans as well as lower costs for those positive health outcomes.
The investment is spread across the university through a variety of disciplines?
What we'll do with the investment is focus on a number of initiatives where we bring teams of people together that are already at the university that normally wouldn't work together. Computer scientists working with educators, working with psychologists, working with social scientists, working with others, bring them together to develop and then seed fund these new ideas and then advance these new ideas out into the marketplace for ideas, attract additional resources for those ideas, and then move the solutions into the health outcomes arena.
Are there metrics to make sure that what you want to see done is getting done, that the results are happening out there? How do you make sure that not make sure, but also do you see what kind of success is really going on out there?
Well, I think the first thing a venture capitalist does is look at the track record of the people involved. And the Piper Trust over the last decade has made, before this grant, over $30 million of investments in ASU. And every single time we have seen the return on the investment. We have seen the measurable results. You recruiting a Nobel laureate, beginning a Center for Sustainable Health, luring away from Harvard, one of the top international proteomics experts, and then creating international networks of support. We know what has happened with the dollars that have been invested so far. We will clearly work out metrics to track and applaud what will be ahead.
And I want to get to some of the initiatives in a second here, but were there specifics? You said, basically, you asked Dr. Crow, what do you need in a variety of ways, but were you asking what do you need within a narrow framework?
Well, One of the areas that the Trust has been very interested in is the way that Arizona, and particularly the Valley, has become this center for bioscience innovation, this center for health innovation. And the Trust has made some major investments in that area with ASU, with TGen, to support that. And so certainly we knew that health delivery, I mean, one of the intractable issues in the United States related to what we had already invested in. We knew that obesity, which afflicts nearly 1 out of every 4 children in Arizona, this matters to us because children are another area. So there was an alignment between the goals of the university and the goals of this foundation.
You mentioned obesity, and one of the initiatives does look at obesity, the epidemic, partnering in this case with the Mayo Clinic. Again, collaboration, partnership, part of the process.
Well, the way that to look at this is that if we're not satisfied with how we're doing relative to obesity, or we're not satisfied with the cost of health care, it means that something in the actual structural model of how we do things, how we organize, how we solve problems, how we produce knowledge isn't right, and what we need, or isn't complete. And so what we're doing is we're saying, let's now go back and look at these things like obesity. Let's go back and look at how we attack the problem. If you can attack the problem by bringing all the disciplines together rather than some of the disciplines, can we find a way to actually produce tools, routines, educational pedagogies, or whatever it is that we might produce that could help lead to a measurable reduction in the obesity epidemic here in Arizona by putting new ways of thinking on the table and advancing them.
And other new ways of thinking in terms of healthcare is prevention and nutrition, exercise, these sorts of things. That's one of the initiatives here. Looking at world data to help best handle worldwide epidemics, that's in here as well. That's a lot of ground to cover.
Well, the way to look at this is this is the case where the problem space that we're working in, health outcomes, is very broad. And what we're doing is we're taking all the talent that we have at the university and sort of organizing it into about 10 or so specific investment realms. We're going to bet on 10 places that we think we can ultimately have a major contribution in terms of improving health outcomes and lowering costs. I can guarantee you not all 10 would work. So it's very much like a venture capital model. You make 10 bets. You hope that several of them will be wildly successful. And that's the approach that we're taking with this particular investment.
Is that a somewhat refreshing, or at least innovative, if not new, approach to higher education research outcomes?
Well, I think ASU is the embodiment of innovation. It is a 21st century university of innovation. And I think the idea of risk capital is something that is central to philanthropy today. If you only make safe bets, you're not going to have the catalytic change that foundations hope and work to achieve.
Is that something that's changed over the years, developed a little bit?
I think it has. I think that originally there was more emphasis on good charitable grants, and those are still important and always will be. But now the question really is, what is the impact? What will be it's not the dollars that matter, it's that long tail of impact that follows. So I think foundations are looking at strategic investments. They know that not all of them will be successful, but they believe that it's the big bets that can really bring the kind of change that can make this country more livable, more economically stable, more humane.
These efforts that we're talking about here, how do these efforts fit into your vision for ASU?
Well, they fit into the vision in the following way. We as an institution have an articulated vision where we, when we do research, want to do research which can benefit the community. We're very much driven by, yes, we want to achieve the academic recognition of great papers and great medals and great awards for our faculty and for our students, but we want to take one step beyond that. We want that energy now to be focused on certain kinds of outcomes. We have health outcomes right now which are not good. We're spending 20%, almost 20% of our economy on health outcomes, and we're securing poor health outcomes overall within the country for the level of investment that we're making. We need to change that to change that, we think, is a responsibility that we as a university need to contribute all of our energy and all of our talent to this. And so it fits very well with the design of ASU, the orientation of ASU, and the way that we've structured our knowledge enterprise.
Last question for you. Is there a message that goes along with this particular investment?
I think one of the messages is our faith in ASU as an economic engine, as a catalytic force in the Valley, and that it's not just new knowledge, as important as that is, but we believe this will affect the lives of the people who live here, our own neighbors.
Is that a message that needs to be reinforced? Do you think
I think higher education is the key to Arizona's future in terms of jobs, in terms of health, in terms of well-being. So I would simply say to everyone, you know, ASU is an investment that deserves our support.
Well, it's good to have you both here. Thank you so much for joining us. We appreciate it.
Thank you.